Hello and welcome to the EduTalk series hosted by Biotone, EduPartner School Program, and massage industry experts. With the continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's experts are Anita Shannon and Garrett Brown. Anita is a past presenter for the EduTalk series, and her talks are housed in the archive library on biotone.com under the EduTalk tab. So be sure to check out the archive library and her past talks. Anita is a familiar face at national conventions and workshops presenting ACE Massage Cupping and MediCupping, both brands she developed in 2002. Anita's published numerous industry articles and comprehensive educational videos on vacuum manual therapies. Additionally, she was inducted in 2011 into the Massage Therapy Hall of Fame and was featured on the cover of Massage Magazine. I think during COVID. So today she's teaming up with Garrett Brown, an LMBT and senior instructor with ACE Massage MediCupping. ACE MediCupping. Garrett's career began in engineering, welding, and machining, leading him to find a new passion in 2012 in massage therapy. He's dedicated to holistic healing and sharing his knowledge of merging technical precision with nurturing care to enhance massage and bodywork practices for inspired client results and self-care. Let's listen and learn as Anita and Garrett introduce therapeutic benefits and effects of magnet therapy and how magnet therapy utilizes magnetic fields to promote healing, alleviate pain, stimulate or sedate nerve function, release muscle knots, hypertensive tissue, and blocked energy. They'll explain how magnet therapy enhances circulation, reduces inflammation, and accelerates tissue repair by utilizing the natural push-pull of magnetism to assist the body's natural processes. Thank you again for joining us tonight. Again, please have your sound muted and video off. Feel free to chat questions or comments, which will be answered either during the presentation or at the end. And with that, I know you have a lot to get to. I'm going to exit the screen. I'll see you at the end of the presentation. Thank you so much, and it's all yours.
Thank you so much, Donnell. Thanks for having us, and thanks, Garrett, for bringing your expertise with you in your back pocket to share with us. Any of you who have taken our classes, you've probably seen these lovely little wonderful things that we work with. And yes, I do tend to put them on myself quite a bit. TMJD, different issues that some of us may have. I do use these a lot because I do have temporal mandibular joint dysfunction. So this helps me maintain, my health and wellness. What these do, the magnets will equalize out inflammation. It's very important which pole you are using. Are you using a positive charge? Are you applying a positive charge to the tissue or a negative charge? So we've done all kinds of different patterns. You can create fields. You can create movement by using the two different poles. Magnetic medicine is unlimited. And if you remember history from some of the classes I've taught, even the Palmer School of Chiropractic Medicine started out as the Palmer School of Magnetic Medicine. And now we've got everything, even fascinating little things coming up like these pulsed electromagnetic field little units. These are for home care. all you have to do is all these different programs, and this just lays on the skin. So magnetic medicine is one of the most effective adjunct therapies a massage therapist can, utilize for their clients. It's very quick. It works with the sympathetic parasympathetic nervous system. It shifts polarity in tissue. It's good for chronic, acute, you name it, the tool will do it. So now that I got to just explain some basics, I'd like to turn it over to Garrett. He's done an enormous amount of research on this, and we're actually kind of looking to him as our company to show us some really new things that he has found out there and develop himself. Thanks, Garrett.
Yes, ma'am. Hello, everyone. And of course, thank you to Biotone for letting us come by and just share our knowledge. And hopefully everyone is really excited about this. I know in times past, people have come up and said about magnets that it's all frou-frou and whatnot. And as Anita said, that it's been going on for decades. It's just some fun history, which I know Anita touched on just a little bit. It's rumored that, Cleopatra slept with magnets. They used them through the 17th century to help offset imbalances. Ancient Hindus believed that if you pointed the body north to south, that it would help the passage of it. So magnetics have been around for centuries and have been utilized in healthcare in all manner. It's also been used recently in the very recent history to help heal bone fractures, help reduce pain, help with scar tissue, things like this. So first I want to talk about what is magnets, or what are magnets and what do they do? So a magnet is a controlled directional flow of energy. So just to kind of give you a a little better understanding of what I'm talking about, I'm going to share my screen with you and see if I can get this to pull up, because we were playing with it here just a few minutes ago. So when it comes to the magnets, we're talking about the actual flow of energy. So when we're talking about the flow of energy, the North Pole is actually negative polarity. That's where the energy actually, as you can see, comes in and around and enters through the North Pole or through the north part of the Earth. This is actually what creates the aurora borealis lights. That energy flow inward pulls in the space particles. They burn up in our atmosphere, giving us those beautiful northern lights. The South Pole, of course, is pushing energy. And this is an important flow. So this is what keeps our planet protected from the solar winds and cosmic radiation. All this stuff is the magnetics, and also what keeps us bound to the Earth. But this flow of energy is how we're going to talk about magnets, as in positive and negative polarity. The South Pole is positive polarity, it pushes. The North Pole is negative polarity, it pulls in. So when we're talking about magnets, we're going to get that push-pull that we're talking about, and that's how we're going to describe and work with the magnets. Now, it's very important to know the flow of energy and what you're working with. So we're talking about that when we're looking at our magnets. I have several little things here. These are the magnets Anita was showing. They're some of our favorites. And ours are marked. Blue is our negative polarity. Red is our positive polarity. So we're creating this push-pull. We're pushing in from the red, out from the red, into the blue. And if you're going to get into magnet therapy, it's important that you know the polarities. What is what? And the way I check it is I have went and bought myself a nice little polarity checker. They're very inexpensive. And what you'll find is a lot of magnets are marked backwards as far as that flow of energy. So this magnet here is one that I use a lot. It shows a positive and it's red. And when I test it, that's actually the North Pole or negative polarity. And when I flip it over to the black side of the magnet, this is actually, it's going to show a green light. That's actually South Pole or positive polarity. So our blue magnet being North Pole, that's how I kind of check and make sure I have which magnets I'm using. So now it's very important to know which magnets are which, because magnets in general, as soon as I find the right share screen, There's the one I want. So when we're using the magnets, the positive and negative really matter due to the, share this with y'all. So the negative field is a little more pH normalizing. It normalizes the pH of the body. It oxygenates the cells. It helps with cellular edema. It's more calming, sedating to the body. Positive polarity does the opposite. It sort of shifts the blood pH from alkaline to acidic. It creates a more hypoxic oxygen environment. And this does not mean that positive polarity is bad. It's actually a wonderful painkiller. When you have positive polarity magnets, you can put them on somewhere that has an acute injury. It helps relieve endorphins and helps our bodies. The endorphins help our body with the painkillers. So these are just some of the great things that they do it. And I think they gave y'all this handout. But so positive charge causes stress, raises the body's own natural painkillers. Negative charge reduces it, reduces acid, hypoxia, and related symptoms. So Anita started off talking about she was using the magnets and she was working around her TMJ. So I use magnets, of course, a lot for the TMJ. And the great thing about magnets, they are one of the most versatile tools that I have ever come across. You do not actually have to attach them to the body for them to function. They'll work through my nice big old fluffy beard. They'll work through my clothes. I use these a lot post-surgery through bandages for knee and hip replacements to help reduce pain levels. So they are one of the most versatile tools that I have ever come across in my time as a massage therapist. And when we talk about the TMJ that Anita was talking about, a lot of people don't realize that TMJ actually starts, or a lot of times will start with C2, because the pterygoid minor, part of the muscle that opens the jaw, goes back and connects to the transverse processes of C2. So I can actually utilize magnets and create a push-pull. So this is for someone who has left side TMJ, or my words are going to tangle on me, but that left side jaw pain, for the left jaw is actually dropping down. So I'm creating this push-pull, this push from the red towards the blue and helping shift the musculature of C2 around, which is going to help that pterygoid minor take some stress off that. And then I'll go work the front of the jaw with my magnets to help relieve pain. So this is that kind of push-pull we're going to talk about. Now, you can use the magnets in two basic forms, in a static field or bipolar field. Static field is basically where you have all the same type magnets. And now, the only time we're going to use all of positive polarity, or in our case, our magnets are marked red, is we're never going to use them just by themselves long term. So we're going to start with something very similar to what you're going to see on your screen. This is a static field. I'm using all negative polarity to kind of help calm down the spine, creating this push-pull. This actually helps engage the parasympathetic nervous system to help calm down that hyperactive of the spine, the nerves running out to the body, and just gives us a lot of sedation to the body. Now, when it comes to magnets, because I'm a nice red-bearded giant, I like to throw in a joke to help people remember. The body, if you imagine it like a party, before you send in that redhead, that hot, pushy magnet, you want to send in a cool, calm friend to check the temperature of the room. Because if you send in all the positive polarity, all them redheads, most likely the cops are going to be called, there's going to be some damage, and the body's going to be a little amped up and creating some inflammation. So you've got to send in a set of negative polarity to help calm down the tissue first. And then we can actually bring in the positive polarity to create a push-pull. And this will be kind of how we do a simultaneous push-pull on the body. So I've taken the same pattern I had, And now I've added in these reds in between. So magnet-wise, or for the actual, in this case, the craniosacral rhythm, I'm actually breaking this down into about 4 parts. So the red magnet at the very top left or next to the spine is pushing down, and that energy is spreading between the 2 negative or blue magnets. That actually creates space in between those vertebrae. And then you step down, and of course, each magnet is working with the next magnet next to it, creating that constant push-pull to open up and calm. This bipolar pattern also helps normalize the body. So all negative polarity helps sedate, shift blood pH from acidic to alkaline. So if you have someone with a twisted ankle, normal process of the injury shifts the blood pH after a twisted ankle from normal alkaline to acidic, bringing in the lymphocytes. The swelling brings in protective, calms things down. And we can help, and people will walk on a twisted ankle for years, but they never allow the body to shift that area of the body back to healing state. So that's where we can bring in our negative polarity magnets, spend time with them, hold them there, give them time, and it'll help slowly start shifting that blood pH back to a more alkali state and get it into a healing mode instead of an injury mode. And so these things are great for all these kind of things. Now, the great thing about magnets is self-care for us massage therapists. And I'm going to see if I can get some magnets on me right here. What we're going to do is we're going to take a negative polarity. That'll go on first. Another negative polarity. And I'm going to land a positive polarity right in the middle. So what I'm doing is I'm actually taking energy in and I'm spreading. So through the nervous system, I'm creating this push-pull, stretching on that radiobrachialis, kind of helping calm and relax and stretch that muscle out to relieve some pain. The radiobrachialis, of course, affects pain around the thumb, the elbow. This is a great pattern for massage therapists to use on yourselves. And of course, we're going to take them off. You take off the positive polarity first, and then the 2 negatives. Now, I just mentioned working with the nervous system. So we've talked a little bit about magnets, that push-pull, working with the spine, creating static fields or all one type field, bipolar fields where we're going to mix negative and positive. And we're going to lead that into where we're going to start working with the nervous system first. Now, the nervous system, every nerve works through a process through what's called a sodium ion pump. Now, sodium ion pump is a very big fancy word for moving potassium and calcium in and out of a nerve to create a waveform. It's basically a chemical electromagnet. Now, if we have someone, one of the greatest things we can do with the nervous system is help sedate areas of the body that are hypersensitive. So if we have somebody that is in their rib cage, extremely ticklish, or someone who has had a surgery like a C-section and the scar and the area around it is just very hypersensitive, we need to work the scar, we need to work the area to help soften some of that, lessen some of the issues they have with their low back, but we can't touch it because they're guarding it, either through a trauma in their past, a surgery, an injury. So we can actually add to or work with the magnets to help calm this down. So how many of you know what the dermatomes are? The dermatomes on the left side of the screen, those are the nerves that come out of the spine and actually control the skin itself. So this nice little display here, there's the back of the body where they start at the spine, wrap around, and each vertebrae has its own pathway that works within it. And then, of course, on this other side, we have the front of the body. You see the completion of the thing. Now, for my picture of my live model, on the right-hand side of the screen, you see I'm holding 2 magnets to her side. This particular client, she is one of my clients. She had an injury to her abdominal cavity, and she's also very ticklish, and that lower area of her belly, and I need to get in there and work. So what we end up with to actually get in and do this work, I take a couple of negative polarity magnets, and you can attach them. I typically hold them. And on the dermatome map on the left side of the screen, you see where I've kind of marked the two magnets. This helps sedate and slow down that nerve function. And I'm kind of calming the area between sort of all the way from the magnets to midline, following that T11, T12, L1 nerve pathways in the dermatomes. This will desensitize the area, allow me to get in and work it. Anita and I were teaching a class in Florida. We had one lady who her feet were so ticklish, if she thought you were looking at them, she could not hardly stand you to even look at them. They were so ticklish. So I took a set of my very large magnets that are about 3,500 Gauss, and I'll explain what a Gauss is, and just laid them sort of under her heel, waited about 15 minutes, and the ticklish started decreasing a little more, and it actually got to where we could massage her feet. And she said that's the first time ever that she's been able to have her feet, have anyone massage her feet. So, and it's just through that gradual calming down of that hypersensitive nerve. Now, on the flip side of that, if we want to excite an area, let's say that we do have an area that is been through an injury, a surgery, and it's numb, or you can't really feel it, we can take a positive polarity magnet and kind of tap it and let off. Tap, let off. And over time, what this is doing is it's basically that redhead screaming at that nerve, hey, 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 and it's kind of re-energizing it a little bit. Now, you cannot always re-engage nerves, but I have had good success post-mastectomies, getting some sensation back in the tissue surrounding the reconstruction, to where ladies can actually feel part of their chest after that. Also, some post-surgery to where there's some scarring, to where like cysts have been removed, and they just lose that sensation through the skin. I've had some very good success working with these. Now, I mentioned Gauss. You'll hear us talk a little bit about Gauss. Gauss is just a form of measurement of magnetism. So the Earth's magnetic field runs at about a 0.5 Gauss, and it varies based on a little bit. So the wonderful little magnets we have here, they're around 1,200 Gauss. They're right powerful. This other set that I have is around 3,500 Gauss. I have some of these little magnetic, they're just little stick-on patches that have a magnet attached to them. Now be careful, this set here, I ordered them, I got them in, and they've got the polarity marked backwards. So if you put them on, you're putting positive polarity against your skin. But they're around 500 Gauss. Your standard refrigerator magnet is going to be around 50 to 300 Gauss. So just to kind of give you an idea of what that power range may be. Now, why is Gauss important? A nerve functions at about 70 millivolts. That's how much energy it takes for a sensation, touching my hand, holding a magnet over it, for me to affect the nerve. About 70 millivolts is how many is the current for a nerve to complete a waveform all the way to the brain. To override it, you have to have more power, or to help pick up and calm it down. So to override 70 millivolts takes about 10 Gauss. And so that's why we use magnets that are a little over that. Does that mean that a magnet that is less than that can't be effective? No, it doesn't. We have found that they have proven that magnetism as low as steady, concurrent, always around you, magnetism of 0.02 Gauss can actually shift your blood pH to a more hypoxic or more cancerous loving environment. And where you get things like that, or things that can do that, it's not all magnets that will do it. It's an oscillating magnet. So an oscillating magnet you find around AC power, electricity, around like high voltage power lines. That's where the energy in the line is going both directions about 60 times a second. that reversal back and forth is actually harmful to our bodies. That's why people who tend to live around cell phone towers, high voltage power lines, there is a correlation to where they do have higher rates of cancer and other full body diseases. So, and there was Dr. Philpott, if I'm saying his name correctly, he studied this and he came up with Anita, you may have to help me with this. It was the magnetic field deficiency syndrome. Is that correct?
Oh, yes. Yeah.
Dr. William Philpott, and he has been in the magnet field affects the earth, the weather, the electrical devices of the earth, and they have proven that they can measure that it's decreased by about half over the past 500 years. And the magnetic field deficiency syndrome, some of the symptoms include stiff upper neck, back, shoulders, things like that, dizziness, headaches, a heavy feeling throughout the body, the head, insomnia, constipation, things like that. And what that sounds like 90% of our client base, doesn't it? And actually, our magnetic field is in one of the lowest points it's been in about 900 years. It's really dropped down to a very low point. Now, we do know through the Earth, through the Atlantic seabed, that it has flopped several times, and they can measure this by the way the iron in the ocean floor is laid out. So with it dropping, I'm just really curious if it will flop again sometime within our lifetimes. It would be a very interesting day, I'm sure. But when it flops, typically the voltage or the power of the electromagnet increases back up. They can measure that through the ocean floor and get a lot of great benefits from it. So long-term consequences of a low magnetic field for our Earth. There's acute symptoms, chronic degenerative diseases, low normal healing abilities, things like that. And so it also messes with our nerve axons and our positive charges and negative charges through our axons and dendrites, things like that. So this magnetic field is extremely important to our body. And so now just some fun stuff so y'all can see, because we're getting close to the end of the talk, and they do limit me a little bit. So I'm going to share a couple different pictures here with you and explain kind of what's going on. So in this picture, we're utilizing bipolar magnets. We're sort of working on a tricep. So I'm actually pushing from the center of tricep out toward the attachment sites, actually creating a stretch through the muscle, utilizing the nervous system and the push-pull of the magnets. And what I do is I layer my treatments in. So I will start off with magnets because I want to save my hands. This is just another tool. If I can get in, I can get a muscle to release, 15 to 20% without me doing anything other than putting a couple magnets on for 15 to 30 seconds, like I would leave these. That allows me, if I can get that muscle to release by about, 20, 30%, that's less time I have to warm it up, less time I have to work on it in a deep manner. And it makes the treatment simpler on my clients. And of course, if you combine that after utilizing the magnets with something like cupping or grafting, it actually just helps speed up the recovery of your client. Now, the next picture, because when I said magnets are the most versatile thing that we can use, we can work three-dimensionally. And, like, what are you talking about? Here's a great example in that same tricep. So instead of working along the long axis of the muscle, I'm actually spreading in. I'm pushing the pressure down into the body, and I'm spreading it laterally. So that's like me taking my hands and separating the tricep. But because I've got two positives next to each other, they're repelling each other. So I'm actually creating a stretch in between the muscle using the two positives. So I'm creating a three-dimensional stretch, movement, and pull using nothing more than magnets. And I use this a lot with massage therapists I work on because we're constantly pressing down with our triceps. And this is a very easy way for me to get the muscle to start to soften speeding up my time? Are you speeding up what I can do and how much I can cover in the body? And in my world, all roads lead to the diaphragm. I'm funny about this. Anita laughs at me. And of course, I know she thinks the world leads at the diaphragm. The diaphragm can be very tender for us to work in. I have found that by utilizing magnets, I can actually get the diaphragm to soften. And when I get the diaphragm to soften, if I have someone who has, say, idiopathic scoliosis, we've done this in class, and I've seen people straighten out. Actually, in my level 2, Anita and I taught, we had somebody stand about 3 inches taller with us using nothing more than magnets releasing. And this is one of my favorite patterns. So on the rib cage itself, I have negative polarity. Below the diaphragm, I'm using positive polarity. And I'm getting this push-pull from the positive down through the belly of the muscle up and around. And three-dimensional space, and it actually lifts and separates that diaphragm. And you can actually visibly watch people, the bucketing of the ribs, take a deeper breath. And this is just, again, this three-dimensional work. After I start with this, then I can go in and warm up the tissue, use a cup, use my hands, and it's gentler on my client. And I can get a lot more work accomplished. Oh man. And I'll show you. Go ahead.
Hey,
Maria.
Garrett, we've got some very interesting stuff in here. For someone who has a watery cyst, that's what the doctor called it, on the top of their foot, could you help move the lymph buildup with magnets? If so, would you place them around it rather than on the bump?
All right, great question. So for watery cyst, now it matters whether this is a third spacing cyst or an encapsulated cyst. So if it's an encapsulated cyst to where it's in a pocket or a gland that can't be moved, we're not going to be able to do much with the magnets. If it's a third spacing or an injury cyst where you've just got a bulge of fluid, that fluid is positive polarity. It's actually more acidic and carries a more positive charge. So I can do a couple things. I can actually utilize a push-pull using the magnets. I can use positive polarity directly over it and kind of actually, instead of attaching it, just kind of sweep with this magnet from, say, around the toes up towards the ankle and past the ankle to help move that where it's hard to get a cup on. I can actually take a negative polarity magnet and hold above it. So I'm actually getting a push-pull using the magnetic process through a fluid. So it all depends on if it's encapsulated in a cyst that is immobile. No, I'm not going to be able to drain it. If it's third spacing or within the interstitial tissue, yes, I can actually help shift the fluid around. And I do this a lot with my breast cancer survivors who have edema when it's so inflamed that I can't cup it and I can't really use my MLD because the tissue is just so tender, so swollen. I will use my magnets to help slowly shift fluid up the arm without ever really breaking the skin. And it will slowly soften and move that tissue. Great question. And this picture is also unique just for that 3D thing. That was a great question. You notice I've got one magnet on the bottom of the foot and one magnet on the top of the foot. I can actually work all the way through the foot muscularly. And in this case, I'm actually sort of stretching down from the top of the foot down into the bottom of the foot. If someone has an arch that's too high or the peroneals are too tight and I actually want to kind of stretch down and get some of that pressure out of the bottom of the foot, I can stretch down. You know, I can flip them over and lift on the arch the same way. And also if I'm using reflexology.
Go. Sorry.
No, that's fine.
Someone walking into my patio in the middle of this.
But for like reflexology, of course, I love it on the feet. You'll take and you like to use the negative polarity or blue magnets and hold right over a reflexology point. And it really does enhance reflexology because now not only am I activating the point, it's actually forcing the energy through it. And of course, I can use a technique like on the screen that you see to where I've got a negative polarity on the bottom and a positive polarity on top to where I'm actually forcing the energy all the way through the foot, not just the reflexology point. But of course, like on a hand, I can come in and just hold or I can take a negative polarity and tap it a few times and just activate the point. And for those of you who are reflexologists, I encourage you to try it with your patients, and then, you know, feel it before with your fingers, activate it with a magnet, feel it after, see if you can change the point, go feel the part of the body you're trying to work.
It's
And
really amazing for that. It's worked really well. There is one here I really want us to get to, though. Contraindications with a sleep apnea implant. Any kind of computer implants, if somebody's got any of the heart, any diabetes, anything that has a computer, please don't bring these near your phone. Don't let them get near your computer, all of that good stuff. So we do have a full list of contraindications. And I think those might be in the handouts you gave to everybody. If not, we will take a look at that. We usually include them more in the full class because we don't have a separate magnet class yet. But yes, there are contraindications. You do need some training before you start throwing magnets on people. There's one other one. Can we talk about this one's really heart conditions. And then someone asked about stimulate the nerves using the Gauss in different strengths. Is it better to leave them on for less time? That depends on the Gauss strength. Yeah.
yes, so as far as heart conditions, it all depends. If someone is in bradycardia or has a heart rate that's too low, I'm not going to bring a magnet around the vagus nerve where it comes out of C2, wraps around and actually comes down through the chest of the heart, because I don't want to sedate that anymore if their heart rate is already low. If I have someone who is going into tachycardia, I will use a negative polarity around them to maybe help settle them down a little bit. I rarely, now an old trick, and one of our colleagues do, if I'm driving long hours at night, I will keep a positive polarity magnet on my dashboard and start tapping my chest over my heart, because it will rouse you awake. I don't recommend it a lot if you have heart conditions, but it will keep you up for those long 12-hour drives. As far as other contraindications that come up would be neurological conditions, epileptic seizures, some of those things where the electrical system's a little miswired. I like to stay away from those just because I'm more cautious. Of course, pacemakers are an absolute, I'm not getting within you in a mile around a pacemaker, because yeah, those make bad days at work. It's hard to make someone look like they fell down the steps on an accident. That is a joke.
I know, I love it. Great questions, you guys. And yeah, I agree. We are prepping a class. Garrett might start with a video first and then go to a live class. I'm not sure. All we do in level 2, especially, we work with the magnets more. In level 1, we introduce them, and we do give you safety and contraindications even at that level, because you need them. But yeah, I'm excited to see us take this into the next level. And oh wow, we've got a lot about cancer. Somebody's asking about the handouts.
I'll jump in on the handouts. For those of you who have not attended an NU talk previously, the day after the talk, you'll receive an email with the recording link so you can watch this again. It will have the handout attached to the email, and it will also have Anita and Garrett's contact information so that you can communicate with them individually. So watch your inbox late morning for the follow-up email. If you do not see it, please check your spam and your junk folder. And yes, Anita, I'll let you get back to the questions. There is someone asking about cancer.
Yes, we have a lot of people asking about cancer. That is a whole huge subject, but if you've really looked at the effects of an oxygenated body on somebody who has cancer, cancer has an extremely difficult time surviving in an oxygenated environment. A lot of times the reason people end up with cancer is due to a very acidic environment. And oh good, we love handouts like this. And an acid pH in their blood. It's supposed to be alkaline and hyperoxic, not hypoxic. When you get lymph that's all congested in the breasts and the belly and the legs, that is creating an area that does not have a good oxygen supply and is a real problem. I think they're amazing for it. And Garrett, what's your input?
All right, absolutely. And I'm sharing my screen here. So the two pictures you see on the left picture is the clump of cells taken from a finger that was injured. And the blood cells are kind of clumping together, which is more hypoxic, it's more acidic. They've treated this finger for 15 minutes using bipolar fields. And on the right-hand side, you see the blood cells actually starting to separate. And when they do this, now they can carry more oxygen. They can carry away more waste. The blood pH shifts from acid to alkaline. So it's just more in a healing state. And of course, when they're utilized with cancer, and I do have some pictures in the note handout. Hopefully, I'm going to finish writing a book that may have some new pictures in it that will actually show before and after pictures of cells, Langerhans cells, things like that. A lot of that's in progress for classes and whatnot.
All right. Rebecca is asking, can you use the magnets on someone who is on oxygen?
Yes, you can. That's one thing about these tools. They're so versatile. So oxygen is not a problem. If you don't attach them to the skin, you can work on the very elderly with very frail, thin skin. You can work through clothing, sitting up, standing up. It doesn't just have to be on a massage table. You can carry these into the office, work on people's shoulders, right around their desk, just holding over their clothing, and can actually very affect how their neck, shoulders, and back feel. So absolutely, oxygen is safe.
All right. Someone is asking about classes. Laura's asking, how can we get you to come to the Midwest to teach a class? Iowa, Illinois, Missouri are beautiful in the fall, especially, and selfishly close to Laura. So
Right, well, I am very easy. I need 10 to 12 students to stay on this side of the, I'm in North Carolina, so I need 10 to 12 students to stay on this side of the Mississippi, 12 to 15. I will travel just about anywhere in the country. So as long as I have a space and 12 to 15 students, I will come to you. And if you want to do a destination class, like go to the beach, I will meet you there. I can do the full host if you want to kind of work it out. If you want to contact us, like from me specifically or Anita, you can email us and say, hey, I want Garrett. We have this many people. Can you set up a class in such and such place? Absolutely. We have a wide range of several educators. You can also check out our website, which will be provided to you to see where classes are already established if you want to attend one. So we do level 1s and level 2s. That's where we do the magnet work mainly. Level 1s is just a basic introduction. Level 2 is taught only by a few of our educators, myself, Martha Graham, Anita, and that's where we really get into that layering in and how do I actually use these for the deep work. So.
And the more we learn about the magnets and experience with them, it's like, do we extend our level 2 into like a, 4 or 5 day workshop, or do we now start keeping our structure the same with our workshops, but now doing, this merits its own 3-day workshop at least.
I'm working on a online class right now, and I'm having to try to condense it so I don't have a 12-hour course you're trying to watch and read through.
Are the magnet classes, are they approved for continuing education credits?
Not yet. That's what we don't put them up until they're approved. That's why you don't see them posted up there. So, and the process, it takes a while, especially with a video presentation. They usually have us resubmit a couple times to get it the way they would like it.
I will say the magnet work is taught and approved ACE MediCupping Level 1, ACE Massage Cupping Level 1, and ACE Vacuum Therapies Level 2. So we already teach magnet work in conjunction with cupping classes, and that is approved by NCBTMB.
Yes.
All right. Are you out and about anywhere in person coming up? Are you doing any traveling, any shows that people can find you at?
Most definitely. We're always at the AMTA show. We wanted to do the American Massage Conference with, the wonderful One Concept group, but we weren't able to, get in for this year. So we'll be there next year. And then, of course, World Massage Festival. So we've got AMTA out in Texas. World Massage Festival is going to be in Vegas. And Garrett, are you going to be at both or just one? Do you know yet?
I know for certain I will be in Vegas. I'm going to have to check the dates for the AMTA. No promises on it right yet, but I'm pretty good about showing up spontaneously at about everything.
Yes.
All right. Now, Nicholas is asking, and I don't want to answer this. Will the handout give us sourcing info on the magnets and how to choose the correct power level? Gauss.
No, they won't, because most magnets, when you buy them, are extremely overpowered anymore. So, like, our set is one of the weaker sets you buy directly through ACE. That's why I love it, because I can use it on the body for long periods of time. Most of what you're going to buy through Amazon, like these, are super overpowered. But understand, most time when you put a magnet on somebody, you're leaving it for 15 to 20 seconds, because how fast does a nerve function? Touch your finger, do you feel it immediately? You're getting that function out of the nerve. So you don't just have to put these on and leave them to let them work. They work very quickly.
Now, for long-term effect, is this something that, uh, you know, they need a massage every week? You're working on a spot. Does the magnetic therapy have a longer term effect? Does that make sense, what I'm asking?
It
Best
does. It
I
does.
say is like everything else that we do, it's cumulative. So you can do one treatment on somebody. Yes, they're going to shift, but if it's a treatment for an inflamed shoulder and they're going to be swinging a hammer for the next 3 weeks as usual, yeah, it's not going to last very long. If it's something, scoliosis and it's cumulative, yes, it's going to, the gains we make are the gains we make. Garrett, what's your addition response?
Absolutely. Well, anytime we add an additional tool that affects the body, like if we're doing just our hands, we've got one-dimensional work, we're pressing in. If we add cupping in, now we're doing two-dimensional work, we're pressing in and separating out. My gains grow. If I add in magnets, now I'm pushing in, pulling out, plus working with the nerves. My gains grow cumulative. So yes, over time it's not just instant fix, but over time you will get the long-term gains you're looking for.
I'd like you to go back, if you would, and hold up the magnets again. Talk about the way they're marked, because some people did come into the talk late and they may have missed that. The negative, positive.
All right. So ACE's magnets, the ones we sell, look like these. And ours, the blue magnet is negative polarity. The red magnet is positive polarity. Now, the way this works, the blue that's negative polarity, that's the North Pole. That's where the energy actually flows in this way and out the top and around. Positive polarity, which is South Pole, it will flow down out of it and around. So you kind of get this flow of energy like this out of it. Now, magnets like this one, it's got the red side marked as positive. It's actually the North Pole. So instead of it being positive polarity or South Pole, it's actually negative. So it's marked backwards. So it's important to test your magnets. I recommend a little electronic device like this. You can buy them most anywhere. They're fairly inexpensive. To test your magnets and make sure that you're using the North Pole or negative polarity to as the calming agent, and South Pole positive polarity as the pushing or exciting agent.
All right. And the little dots, the little gold magnets.
Yes.
I'd like people to know what's out there. And again,
so this is a little gold magnet. It's on a sticker that just sticks directly to the body. And now be careful, because these are actually marked backwards. They have the positive polarity against the body. You can pull the magnet off and stick it back to the little charge piece there and have it so it doesn't inflame the body. But it looks kind of like this, and it will just stick right to the body. And that's a way for you to let a client walk around with it. Just remember, test the direction of flow of energy so that you're not putting a positive polarity on someone and they're walking around with it for a week, because you're going to, yes, you will get some pain relief from the endorphin release, but you're going to inflame that area. So,
All right. Well, I haven't seen any other questions come in or comments. What if someone is on blood thinners?
perfectly safe to work with blood thinners. You're not really going to hurt the blood. You're going to help shift the blood pH to alkaline, which is healthy for the body, but you're not going to break any membranes. You're not going to hurt the body in any way.
And Nicholas is asking, where is a good source for something to check the magnet polarity?
Like I say, if you can get just a regular old school 1,000-year-old compass, which uses magnets, or like I say, I like these little magnet testers. This is my go-to. You can buy one of these on Amazon, I think, for about $6. It's electronic.
Yeah.
You just basically, they're great. You push the button, hold it up to the tool, and it's going to mark North Pole or South Pole, and that's going to tell you whether it's North Pole is negative polarity, South Pole is positive.
All right. Thank you for reviewing that. All right. Well, I would like to take a moment and mention our February 18th Edu Talk with Adrian Asta from the Massage Therapy Foundation. This is Heart Month, and she will be presenting on the role of massage therapy in supporting heart health. The RSVP for Adrian's talk will open tomorrow. Again, there'll be a link in the follow-up email, which if you do not see it in your inbox by noon, let's say, please check your junk or your spam folder. Visit our archive library on biotone.com under the EduTalk tab. Anita has presented for several years on some great topics, so you can catch up on those. If you need her handouts from past presentations, feel free to email me for copies. And thank you both for your presentation. Your information provided is really good. Appreciate it. Thank you, Susan. All right, Nicholas, thank you, everyone. Really appreciated the info, the pick. Looking forward to watching the replay. A lot of information. Well, thank you so much. Thank you, everyone. And be inspired. Join us again for the February 18th. Visit the archive library on biotone.com. I think I've said everything. If you are not familiar, we also host the EduTalk Diabetes series, and those talks are also archived in the archive library on biotone.com under the EduTalk tab. And you can RSVP there as well. Thank you, everyone. Be safe. Join us again. Thank you, Garrett. Thank you, Anita. And thank you, everyone, for all you do for the massage profession. Take care, and we'll see you again soon.